Uh, it's what? Do we have the majority of the members? Robert, Robert, we need you to start, and then we'll get you to go down and see if you can find Pierre. Okay, we'll come to order, and we're pleased to have witnesses here this afternoon on the further discussions on Bill C-44, which is an act to implement certain provisions of the budget tabled in Parliament. I think, as witnesses know, the bells are ringing, and what we intend to do is we think we have time to hear everybody's presentation. We will go vote. And then we'll come back and spend a half an hour or thereabouts on questions with witnesses. So first witness is up is the Equiteus Society, Mr. Bedard, who's the representative, and Mr. Campbell. The floor is yours.
Yes, good afternoon, Mr. Chair, distinguished members of the committee. Thank you very much for having us here. We sincerely appreciate the opportunity to come and testify on behalf of the Equitas Society. My name is Major Retired Mark Campbell. I'm one of the 6 representative plaintiffs in the Equitas Society, or in the Equitas lawsuit, class action lawsuit, and my compatriot here, Corporal Retired Aaron Bedard, is another one of the 6 plaintiffs. We'd first like to express our gratitude for what was included in Budget 2017, which of course was an education benefit, yet to be defined, but an education benefit nonetheless, and a family caregiver recognition benefit, both of which are new benefits, long overdue, and we are certainly grateful to all the authorities associated with the adoption of those initiatives within Budget 2017. The devil, of course, being in the details, and we don't know the details yet as regards the education benefit and the qualifying criteria, which we often find become exclusionary in their actual application on the ground, and that will remain to be seen. Our concern lies primarily with the financial compensation package and financial parity between the Pension Act, the former Pension Act, and the current new Veterans Charter. As you may or may not know, the Equitas Society was in fact formed as the fundraising arm of the class action lawsuit, which seeks, above all other things, parity with the former Pension Act for those who fall under the new Veterans Charter as of the 1st of April 2006. I'm a perfect case in point. Had I been injured on my first tour of duty in 2002, I would be under the former Pension Act. As it is, I was injured in 2008 and on my second tour of duty in Afghanistan, and as a result, my injuries are covered under the new Veterans Charter. A direct result of that is a 46% reduction in my family's expected financial compensation over my lifetime. That is a significant amount of money. 46%, yes. So the concern here is that although Budget 2017 makes allusions to a pension, or reinstatement of the pension for life for Canada's veterans, the can was kicked down the street yet again, and we saw any details regarding the pension for life, implementation timelines and details of the implementation, indeed what it would entail, in essence, we've seen it deferred yet again. So our concern, of course, is this ongoing disparity between the former Pension Act and the new Veterans Charter and the financial implications thereof, not just for the veteran himself, but for the family unit as well, which may as well be included in the definition of veteran because they're there every step of the way along the journey with the veteran. And we've yet to see some family benefits be restored from the Pension Act. We've yet to see any porting of some of the benefits available under the Pension Act into the new Veterans Charter as has been recommended by the Minister's Policy Advisory Group. So our concern is what appears to be a dragging of feet, if you will, in terms of consolidating financial benefits for veterans into something that's easily understood. The benefits package right now continues to become more complicated as opposed to more simplified. And we're concerned about the actual, at the end of the day, it comes down to, yes, dollar amounts. and the amount of money in veteran families' pockets in order to have a medium standard of living or a moderate standard of living, and to be able to do the things that other Canadian families in many cases take for granted, such as raise children, send them to school, and help them launch into their own young adulthoods. I'm going to leave my comments at that. One of the other things I will say as I hand the mic over to my compatriot here is that Equitas is interested in parity in all aspects of veterans' care and compensation, and that would extend to access to mental health and mental health facilities. And at that point, I'll turn it over to my cohort.
Thank you, Mark. I'm good for a few minutes. Okay. Again, there's a lot of programming towards veterans in this budget, and that's always a good thing for veterans. The key point in this, though, is for the issue I'm having is with the $20 million towards the Center of Excellence. I'm actually the one that helped encourage that be included in the original veteran platform for the election. And that money was costed specifically for the building of a physical place to treat veterans with PTSD. And now here it's a year and a half later, I'm part of a mental health advisory group that's been briefing the minister, working very hard to make sure that it ends up being that way. And so in this budget, the Center of Excellence appears to be a bag of money to go towards research. Now, we have tons of research happening. CIMVR, for the last 6 years, has a gathering of 500 to 800 doctors, and they all like to talk research. Veterans need a physical place to get treatment. When we do get sent for treatment, it's usually after the person's ruined their life to a greater degree. Everything's a mess, or everything's about to, fall off the edge, and they send us to addiction centers, 12-step programs, and there are places where you can end up being trying to seek treatment within a group where you're also there with criminals, organized crime, gang members, drug dealers. And it is not a conducive environment. I was there with RCMP as well. I went to one in 2013 for a brief time. And I was also, while I was there, as Ron Francis, our CMP member. He got in trouble in 2013 for smoking pot in the Red Surge. For those of us with our PTSD, we'd see that as something that, he's raising a flag. He needs help because he's not in his right mind to be doing that. He was there while I was there, and he lasted about a week. Our CMP member was not comfortable talking around gang members, drug dealers. He left, and 6 months later, he took his life. I have a letter recently here from 2 other RCMP that just this last few months there that had to go to one of the Woods facilities, and it was the same thing. They were in there, and one of the people that were in there with them is a member of organized crime at a high level, and several other criminal-type people that kind of make it feel like a prison environment, and about hierarchy and ego and who's done the most, and that is not the kind of treatment we need. That's why I pushed Harjit and Andrew Leslie in 2015 to please, within their platform, include an inpatient care facility where we can bring veterans in there at the beginning, rather than wait until they're addicted or abusing alcohol excessively, anger out of control. Wait until their life's falling apart to then send them to care is the wrong way to do it. We should be catching them at the beginning. So I'll just stop there. I am part of the Mental Health Advisory Group advising on mental health for the minister, and Mark Campbell's part of the Policy Advisory Group working to try and make the pension happen. So if you have any questions, thank you.
Thank you very much, Mr. Bedard. With the Mental Health Commission of Canada, Mr. Rodrigue, Vice President, Organizational Performance and Public Affairs. Michael.
Merci. Thank you. Thank you for inviting the Mental Health Commission of Canada to speak with you today on the Budget Implementation Act. We are, after all, your commission, and it's always a pleasure to act as your trusted advisor on matters relating to mental health and wellness of Canadians. Depuis que la Commission de la Santé...
Since the creation of the Mental Health Commission over 10 years ago, funding from the Government of Canada has allowed us to deliver new research, programming, and resources that have served to improve Canadians' mental health. We are now celebrating 5 years of the strategy. It was through the funding and mandate provided by parliamentarians like yourselves that allowed us to release the Mental Health Strategy for Canada 5 years ago. It's a document used by provinces and territories across Canada to better direct mental health services and see real progress in delivering these resources.
Released an updated analysis of government mental health spending called Strengthening the Case for Investment, which clearly demonstrates that making investments early in mental health actually ends up saving governments money in the long run, as well as lead to better outcomes for Canadians living with mental illness and their family. And in keeping with that increased record of investments in mental health, we were particularly pleased to be renewed by the Government of Canada this past April. This renewal will allow us to realize our mission, mental health and wellness for all. It is in that context that we viewed the very exciting investments in mental health as part of the new health accord and included in the legislation currently before this committee. These historic investments are really desperately needed and cannot come soon enough. But this money will only be effective if it is spent in the right area, spent responsibly, and reported on in a manner that allows governments to capitalize on the cascading effects of investments that are proven effective. Timely, accurate, and above all, shared data will be critical in this respect. To that, I would like to share with the committee some of the work that the Mental Health Commission has done previously on developing indicators to guide governments in making the very kind of investments currently under consideration. In 2015, we released Informing the Future, Mental Health Indicators for Canada, which comprised of 55 indicators that together paint a picture of the mental health of children, youth, adults, and seniors. The objective was to create a pan-Canadian set of mental health and illness indicators. This looked at mental health in different settings and reported on aspects of services and supports used by people living with mental health problems and illnesses. It also identified gaps in services, allowed stakeholders to gauge progress, and strengthened efforts to address the recommendations in the Mental Health Strategy for Canada. As part of our new mandate, we intend to build on our Pan-Canadian Indicators project. It is our hope that this work will help inform the efforts of provinces and territories as they look to deliver results with these new federal investments. Maintaining a national perspective while respecting provincial and territorial differences will be critical for success. We particularly hope that governments will explore opportunities beyond the traditional large health sector players, as community-based models of care have been demonstrated to be some of the most effective methods of delivering mental health supports. This includes programming such as the Commission's Mental Health First Aid courses that, just like physical first aid, train individuals to deliver aid to those experiencing a mental health crisis before more professional assistance can be delivered.
Les avantages du soutien communautaire sont... The advantage to community-based supports are clear, particularly when taking into account the need to ensure that services are delivered in a culturally appropriate and sensitive manner. The advantages for isolated communities and Indigenous peoples are also easily seen when one considers the practicality of equipping community members to deliver mental health support.
I would like to reiterate the Mental Health Commission's high hopes for mental health spending committed in the budget, and when time permits, we'd be happy to take questions.
Okay, thank you very much. Turning then to Mood Disorder Society of Canada, Mr. Galson, Associate National Executive Director.
Thank you, Mr. Chair, and all members. Thank you for the opportunity for the Mood Disorder Society of Canada to take part in this important meeting and to provide our comments to the committee. Since 2001, MDSC has worked to help people with mental illness improve their quality of life. We work with the public, private, and voluntary sector, those providing frontline primary care, educators, and people living with mental illness, their families and caregivers. MDSC is engaged on an ongoing basis in major national projects, working closely with national, provincial, and regional partners. As a national organization representing people with mental health issues, today I would like to be their voice at this table. To best reflect their views, I would like to provide you with key findings from 2 of our national mental health care surveys that consolidated their input. In 2011, MDSC conducted a pan-Canadian mental health survey which received 3,125 responses. Important to note that over 500 individuals took the added time to write out specific comments on the survey questions. The results told us that while there had been improvements in mental health care systems, there were many improvements desperately still needed. Of particular concern to Mood Disorder Society of Canada was that 35% of the respondents indicated having to wait more than 12 months for a diagnosis. Comments cited the shortage of professionals available to diagnose and treat individuals with mental health issues. 52% of the respondents reported visiting a hospital emergency room because of their mental illness, and 50% of those respondents indicated that they were moderately to extremely dissatisfied with the care they received in the emergency departments. 82% of respondents indicated they were able to access the medications they needed to treat their mental illness. However, some of the respondents indicated that this meant going into debt, rationing drugs, and staying in stressful situations to take advantage of benefits programs. We followed this up with a second survey in 2015, which received over 2,200 responses. 4 years later, we learned that of the top 2 priorities suggested for government action, 91% of respondents indicated that increasing access to mental health care professionals was their top priority. 88% reported the need to focus on increasing community mental health services. When asked directly, 38% of respondents indicated the time between initial help seeking and diagnosis exceeded 12 months. So the four years from 2011 to 2015, we actually got worse. The majority of individuals have been dealing with mental illness for more than 10 years, either firsthand or through provision of care for somebody experiencing mental illness. We realize that the federal government cannot dictate to the provinces how to deliver health care services. However, we note the negotiations for the health accord with the provinces and the federal government's demands of the provinces to significantly increase expenditures on mental health care was very successful. A more unified approach to knowledge sharing and best practices replications is a key to improving program availability and lowering development and delivery costs, and this should interest everybody. The federal government is directly responsible for the health care of millions of Canadians. RCMP, our armed forces, veterans, Indigenous peoples, correctional workers, and the large federal workforce. The government can lead in healthcare transformation by supporting innovative foundational mental health programs that take new approaches that address core issues identified by patients and caregivers themselves, and that support recovery and promote wellness. Innovative programs such as Project Trauma Support, located in Perth, Ontario, which is a week-long concentrated program for military and first responders who have had their lives ravaged by PTSD. Project Trauma Support incorporates equine therapy, rope training, group psychotherapy, and peer support. The program allows participants to process their experiences and authentic emotions and to improve the lives of their families and peers in the process. The success of this program is having on changing and saving people's lives is incredible. While professional help is very necessary, it's not always available at 8 p.m. or midnight when the person needs someone to talk to. With peer support programs, people have a network of peers who understand what they're going through because they've experienced the same things. Peer support programs also form a crucially important referral resource for community health care providers. There's not enough support for peer support programs across Canadian communities, leaving gaps in supports nationwide. peer support programs have been scientifically evaluated and show to be highly effective. In 2013, MDSC signed a 5-year contribution agreement with the Government of Canada with project partners, the Mental Health Commission of Canada.
Dave, I am going to have to cut you there regardless how much you got left, even if it's only a minute. We're down to less than 3 minutes to the vote, and if we don't get to the vote, we'll be in trouble. So we will suspend and finish immediately after the vote. Meeting suspended. We'll reconvene, and my apologies for the interruption, folks, but we did 2 votes, so we won't have to skip out at 20 minutes from now again. Finishing up with Mood Disorders Society of Canada, Mr. Gallison.
Thank you very much, Mr. Chair. While professional help is very necessary, it's not always available at 8 p.m. or midnight. And I talked about peer support and the importance of supporting that across Canada. In 2013, Mood Disorders Society of Canada signed a 5-year contribution agreement with the Government of Canada, with project partners the Mental Health Commission of Canada and the University of Ottawa Institute of Mental Health Research. Together, we helped develop the Canadian Depression Research and Intervention Network, CIDRIN. CIDRIN now has 7 depression research hubs across the country involving 53 research institutions and organizations working together on depression, suicide, and PTSD. We now have 4 major research projects moving forward. We also have a hub focused solely on Indigenous wellness issues, and all researchers are of Indigenous heritage and are located in all provinces across the country. This is an example of the federal government leading innovation to address mental illness. I'd like to thank the federal government for its support in our Transitions to Communities program, a partnership between Mood Disorders Society of Canada, Opportunities Fund of Employment and Social Development Canada, and Veterans Affairs Canada. Our goal is to assist nearly 450 veterans in 3 cities over 3 years who are experiencing obstacles. The program provides direct supports to veterans with a focus on employability skills, mental well-being, and peer support. This is another innovative program which incorporates mental health knowledge and wellness maintenance into the daily lives of participants. In conclusion, the budget under discussion has significant positive support for mental health, wellness, and illness programs and initiatives, and we commend them to you and urge you to support the budget's implementations. I thank you for your time.
Thank you very much, Mr. Gallison. Then turning, and we'll go with 5-minute rounds. Mr. Ouellette, you're first up. We can go to 7 if you want to.
I think we have.
We have time.
Well, we've got almost an hour and 45 minutes, so I think.
For this and the other panel. Okay, yeah. We'll go with 7 minutes. That's the way you want to go. 7 minutes, Mr. Ouellette.
Merci beaucoup.
Thank you very much.
I was reviewing the mental health services and what the government's providing. So obviously we did the major agreement with the provinces, and it's a proposal over 10 years. But I was wondering if you're satisfied, and this is a question for Michelle and Dave, I was wondering if you're satisfied with the reporting mechanisms to ensure that these services are actually being offered and done in a way that is appropriate.
Maybe you can start and let Dave wrap up. I'm not sure it's about being satisfied, it's about being able to accurately reflect what the investments are creating in terms of faster access to services when and where people need them. And in order to do that, we need to acknowledge that as part of the accords, each province and territory will invest these new federal investments to support their own strategies that they've developed. A lot of them are inspired by the national strategy, but there are nuances and differences. So they are likely to track different components. In our work, we firmly believe that it is possible to have a meaningful set of national indicators against which each jurisdiction is able to measure themselves. And I believe that should be our goal. In terms of where investment should occur, which I think was the other part of your question, certainly what we've learned is you can't go wrong in investing in youth and children, because those investments certainly bring returns on investment and change their quality of life forever. But there are also major needs across the spectrum in terms of at-risk populations and different age groups.
A really, really appropriate question, and thank you for asking it. A couple of things that I have to add to Michelle's comments is number one is the indicators are based on a lot of times on billing codes, and billing codes from province to province are different. doctors billed in different codes across different provinces. There are some really successful programs that have been implemented in certain provinces. Take BC, for instance. Physicians have new billing codes to provide additional services and follow-ups for people who are working through mental health issues. So are they able to bill the provincial government to make extra phone calls, to do extra meetings with the patients and stuff. And that has seen some really good outcomes. So the outcome indicators across Canada have to be something that the provinces and the federal government need to work together on to make sure that they're appropriate and even across the country. Another thing that I would like to add is the fact that people with mental health issues themselves and their families and caregivers need to be involved in all aspects of healthcare delivery. People with mental illness want to be part of their wellness plan. They want to be as involved as any other medical professional because they have the vested interest in there. So I strongly encourage, and in whatever way, shape, or form, that the people with lived experience of mental illness, their families and caregivers, are engaged and included in decision-making processes, but also in the research and reporting structure.
Thank you very much. Now I have a couple questions for Monsieur Bedard and Mr. Campbell. It was a very interesting presentation. And I'm pleased to hear that you were happy with some of the new programs that they're implementing. But I was really interested in the comment from Monsieur Campbell. So you said as there's more benefit packages, it becomes more and more complicated to administer, and I suspect there's more increased costs. I was wondering if you could just address that for a few moments.
Certainly. What we find is that the new Veterans Charter, if I was to use an analogy, we could call it a rotten old leaky tire. And what happens is the government continuously, from our perspective, applies Band-Aids onto that leaky tire or patches onto the leaky tire. It's still leaking. It's still a rotten tire. It's going to have to be replaced, but we keep putting these Band-Aids on top. And every time we apply another solution or another benefit to the mix, without consolidating those financial benefits, we create a more complex mix that the veteran himself ends up having to navigate, sometimes with the assistance of a case manager, sometimes without. So I guess our point is we always welcome new benefits. Nobody would ever, you'd be a fool to say no to a new benefit provided it meets the target audience's need. But at the end of the day, if those new benefits aren't consolidated with other benefits into a more simple approach, we're going to risk confusing veterans even more. And I can tell you that confusion is already rife out there.
And I have a question for Mr. Bedard. It's related to the cost of mental health centers and to the centers of excellence. Because I suspect what happens is when you have someone who has perhaps arrived at a certain point in their life with perhaps PTSD or other mental health issues, and they were a veteran, and we place them in a 12-step program. And there are various mixes of people within those programs. They're placed within those programs in centers because perhaps there's not enough veterans at the time who might need those services. Is the current way we're offering these services appropriate for veterans? Maybe we should be using military facilities, hospitals in Edmonton, Winnipeg, Quebec City, and Montreal, for instance, other places, in order to offer some of these services where it might have a more concentrated group and population where something beneficial might happen.
Well, the issue right now is that they're not sending people into these programs until they're a mess. They're like at their bottom, at their end, when they come ask for help, like get me off the street. That's usually at a point where they're thinking about suicide. And very often they'll still have to wait months before they get to the program, right when they're at the end of the rope. Now, what we're pushing here for is to get programming that will catch them at the earliest phase of developing issues with PTSD, rather than wait till the end. Because right now, we get them into 1-hour sessions once, maybe twice a week, and that's like taking your car to the mechanic on a Monday saying, I need to drive to work every single day here, I need it quick, and they come back at you saying, we'll fix it, but we'll just work on it 1 hour a week, and it's going to go on forever. We need something foundational at square one. We don't want to see guys wait until they're at the end of the rope, and then, like I have this story right here, I just dug it up with the 2 RCMP fellows that went to a program just out of Toronto, and they're in there with organized crime members, and they're completely uncomfortable with speaking. They were there for 10 weeks, and they tried reaching out to the people through the chain in the RCMP, and they said, just go through the program. Just do the check in the box, and then you get something on a form, and then you can be able to come back to work. Just go through it. Just do it. It's not good.
We'll have to cut it there, folks. Mr. Leipert.
Chair, and thank you, witnesses. Mr. Rodrigue and Mr. Galson, I don't want to be inconsiderate, but we had an entire panel here last week for 2 hours on mental health. So we've asked a lot of questions on mental health, so I have limited time. I might get to you two fellows, but I want to get a better understanding of our situation with veterans. I think before I start, I think it should be noted to Mr. Campbell and Mr. Bedard that this committee, before commencing these hearings, asked the chair to write to the chairs of 5 separate committees like this in Parliament to study parts of the bill that were more relevant to those particular committees. And one was Veterans Affairs, and unfortunately, whether it was the committee or the chair or whomever, chose not to take our invite up. And I think that's unfortunate because just having the few minutes that we're going to have is not going to probably get us the information that we need. But I did want to get a better understanding of two things. One, the treatment that you talk about, and then secondly, a better understanding of the pension situation. It seems to me like this has been just continually churning out there for far too many years. And I know that the Minister of Veterans Affairs, I think, is trying hard, but he keeps hanging his hat when we ask questions about things on the fact that they've opened X number of veterans intake centers across the country. And I guess, Mr. Bedard, and sometimes it comes down to either-or situations. In your view, would the government have been better off to do what you asked for versus reopening these intake centers across the country?
Well, they were all promises on their mandate. They had a very large mandate specific to the inpatient care. That was very specific. I had no interest in opening physical places in epicenters across the country because very often these fellows that develop PTSD and multiple injuries often prefer to go out to remote regions, small towns. I was more consumed with the idea that, and been pushing for a few years leading up to that election, to have free roaming case managers that can work out of home and be up in regions where they'd be able to get at people, because we've got a big vast country and we don't all live right next to the city, right?
Mental health is a pretty broad term. What kind of treatment do your veterans with PTSD really require? Is it typical mental health provision, or is it more counseling? I just need to understand a little bit better on what, because I think you mentioned that so often you get sent to an addictions treatment center. Well, that's a total different situation in my view than PTSD. What specific kind of treatment is required?
Well, I just put a name to it, being the reboot program, like you're rebooting a computer, and catching them as soon as possible, as trying to encourage the use of biometrics so that troops coming immediately off of a tour, we can be tracking them right away. There's one tech called M-Wave, and it actually has a part that can track your nervous system, and it's very plain to see when you're getting high triggered. And so people outside of the unit can review data over the course of a week and see where people are having issues, and then catch them at the earliest phase. Because what happens is they mask that one, more developed, they mask that, they mask everything they can, they start self-medicating, and as you're masking it, it's coming out in bad ways. Anger around the family, around the kids, around the wife. We need to catch it at square one, rather than wait for a guy to go 5 months, 5 years or more, trying to just get to the end of their career. We need to catch it early on. Education systems don't necessarily focus these days very much on life skills, and one of the foundational life skills I'd like to see more for soldiers is on mental health. and this might possibly be a point to catch them at an earliest phase, where you take them away for 1 month out of the unit, and give them some good skills on how to cope without having to use pharmaceuticals per se.
Right. I just want to understand a little bit more, Mr. Campbell, about the pensions, and I think that I don't think it's any secret. Military is not a highly paid profession. I mean, your members are not what would be considered highly paid profession. So on that basis, most pensions are based on what you earn. So what, in rough number, in real numbers, what does a pension look like for someone who's coming out of the military?
Well, that's a good question, and I guess it depends on the degree to which they're disabled. If we're talking about someone who's seriously disabled, then they're going to need, as a minimum, the earnings at 90% or better. They're going to need what they were net receiving before they were injured in their pockets as a minimum to continue with some degree of financial security for life to support their families. The other thing you need then are what I would call the costs of being crippled. And there is a distinct cost to being disabled. And if you're severely disabled, then your ability to do things like maintain your own household, do the physical things that I used to do, swing a hammer and drywall walls, I can no longer do, so I have to throw money at every problem that occurs within my household. I can't take advantage of seat sales to go on a family vacation because I have to have certain seats on the aircraft, I have to have a certain type of accommodation at the other end. So I just throw those quick examples to give you an idea that there are costs that need to be compensated that are specific to being disabled, and those vary with the degree and the type of disability. So that has to be added into or factored into any pension for disabled soldiers being forcibly released from the forces under what we call a 3B medical release. And then there are the family considerations. Right now, under the new Veterans Charter, there are no family benefits, none whatsoever. There are some being proposed, a caregiver recognition benefit, but there are very few other than right now a caregiver relief benefit. All the benefits most of the benefits for the spouse, most of the benefits that compensate them as attendants, the benefits that accrued to the children, they're all gone. They've all been removed. So again, we have to look at some form of appropriate financial compensation for caregivers who give up their entire civilian careers. My wife gave up a $60,000 a year career in order to care for me in the home. The government is now proposing under the current budget that she receive $1,000 a month or $12,000 a year tax-free for performing those services. Well, quite frankly, that's inadequate. It's a nice gesture, but it's inadequate. So we need to look at a whole package when we talk about a pension for the disabled. And right now, there are critical elements missing from that package.
And are you anywhere near that with Veterans Affairs, or where are you with?
Well, I can put my
Mr. Campbell, tag on to the same question as Ron, actually. One of our difficulties here is we are dealing with a budget bill, and just going through your presentation, I don't think you have severe problems with this budget with what's in it or what isn't in it, or I couldn't detect that. But you do have problems with the process of how some of the budgetary matters that come before us are being handled elsewhere within this government system, whether it's Veterans Affairs or under the Charter or whatever. And I guess I'm betwixt and between. I don't know where we can go on that, whether we should. That was why we were hoping that you would end up before the Veterans Affairs Committee, because then they can make a recommendation they would recommend to us, but then they can deal with the issues which are real issues that you put before this committee. But we got to deal with the Budget Implementation Act, and I don't know whether we even can make a recommendation, to be honest, outside that to a minister to say these issues had to be dealt with by your department. So in part related to Ron's question, go ahead and answer. But that's where I'm coming from on this.
Yes, sir. I think the biggest concern with the budget from the implementation perspective would be the pension itself and the question of a lifetime pension, the return to a lifetime pension for disabled soldiers. And what we see is a budget that makes mention of a pension yet again, makes promises of a pension down the road yet again, but there's no meat. Completely absent is any meat to include, to my knowledge, any costing of what a pension like that might look like within this budget 2017. So the question, that begs the question, when do we see a budget that addresses the pension? Is it 2018? Is it sometime after that? Is it leading into the next election so we can dangle the carrot some more? We don't really know. And that's the problem. We don't really know.
Valid point, Mr. Dussault. We'll grapple with that too. I'm not sure where we're going to go in it. Mr. Dussault.
Merci, merci.
Thank you. Thank you for being here today. I'm sorry about the interruptions. I'd like to discuss the transition from military life to civilian life as experienced by many soldiers every year. And in C-44, there are new measures regarding education, regarding training, when somebody would like to change careers, for example, and also transition services for veterans so they can search for a job. So that's what I will be focusing on. Regarding education and training after military life, what is currently available for veterans, and how will the new benefit better meet the needs of veterans? And is that program a response to a request by veterans? Does it adequately meet your needs?
Not that good, and this wasn't working. So is there somebody here who can help maybe press this up in English? Can you help?
I can maybe translate myself.
Yeah.
I was asking about the education benefit for veterans.
Yes.
Is this something that was asked by veterans?
Yes.
And is this a good response in your views to what was asked, and or if this committee could look at some improvements to this program?
Absolutely. This is something that the veterans themselves have been requesting for a long time, was an education benefit, something akin to the U.S. GI Bill, as it's called, wherein they provide a college education or certain benefits towards a college education based on 4 years of service. In our case, obviously, the criteria have yet to be defined. We know some of the basic outlines. For instance, it's based on 6 years of service, gets you a certain amount of money, $40,000. 12 years of full-time service gets you access to $80,000. But we're not sure about how those monies can actually be spent, what they can be spent on. The devil is always in the details with regard to this type of legislation, and when the guidelines come out, they have in the past, I must be honest, they have in the past tended to disenfranchise more people than they helped. The regulations actually serve to exclude the majority of people who could probably benefit from those benefits. In the case of the education allowance, I don't know, because we don't have the details yet to parse in order to know whether or not it's going to serve its intended target audience completely the way it's intended to. But I can tell you on the face of it, it is a very welcome benefit, and it's greatly appreciated.
And there's another issue with this, though. 2015, we were in front of a Minister of Veteran Affairs who is pushing an education benefit to us, trying to settle the court case, the Equitas case, and 4 people were eligible, 4 of the 6 plaintiffs, and went through the abeyance period in the election, but in the end, all 4 of them got denied this new benefit. So it's always in the best spirit, I'm sure, for government to push out these new programs, but then you have to remember that they're going to get handed over to the bureaucracy. They design internal procedures behind them for eligibility criteria, and they're often very archaic, that their own case managers don't necessarily understand who are eligible within the program. Very often they will just deny them to a program rather than risk approving somebody that when they don't really understand the benefit very well. There's a lot of problem with the delivery. So I don't doubt, like, it's a great program up front here, but a year or 2 from now is when we find out whether people are actually getting it.
a good point, and I think it's we can see that in the actually in the ER program, where it's a good program, but only 4 out of 10 can access the benefits. 4 out of 10 workers. And are you able to maybe give a number of people who will be able to access this program? How many veterans would be going back into education?
Talking conceivably, we're talking, well, hundreds, potentially thousands a year. The attrition rates are quite high. The turnover in certain trades within the Canadian Armed Forces is very high, particularly your combat arms trades, the pointy end. It's over 50% attrition in a 5-year contract. So conceivably, with this, I know that there was a lot of discussion with the Canadian Armed Forces in developing the new education benefit so that it would not exacerbate the attrition problem by encouraging people to get out too soon.
Yes.
That's why the 6-year threshold and the 12-year threshold. So I think conceivably when this thing gets up and running, you're going to see thousands of veterans taking advantage of it, and ones who don't necessarily transition directly into school out of the military, but have 4 or 5 years to make up their minds and to go back to school when the time is right for them. So yeah, thousands.
And the other point was the redesign of the career transition service to Canadian Armed Forces members, survivors, veterans, spouses, and common law partners. Have expanded access to support such as coaching and job search training. Is this something also that was asked by veterans groups? And is this something you think a lot of veterans will benefit, and how it is comparable to what the services has already been given to the force?
The services up to date, in my experience, were somewhat of a patchwork, and there was nothing very coherent in the job search, resume writing assistance, and those other things. It varied from base to base across the country, and I don't think there was a standard slate of services that were available to people. Under the new enhanced transition services, I think what we're going to see, if it comes to fruition the way it's envisioned, is a standardized suite, almost a concierge service to assist people who are releasing from the Canadian Armed Forces. And part and parcel of that service will be referral to things like resume writing exercises and job finding assistance. Will it be welcome? Absolutely. Have the veterans been asking for it? Yes, I believe they have, because it's a necessary component of a successful transition to life as a civilian. One has to have purpose when they leave the forces, a new purpose, and part and parcel of that new purpose is new employment.
Quick, what do you think of the program now we have to employ former veterans, former military in the public service? There's a new program, and there's some reports that it's not working very well, and people don't get the job. So what do you think of that program, and should it be also considered?
I think the intention of preferred hiring or priority hiring is good. The intention is beneficial. It's, again, the devil's in the details, and it's the execution that has been the problem historically. What you find is the vast majority of your attrition are the junior ranks, the corporals and the privates. They lack bilingual skills, they lack university educations as they release. Therefore, they're not eligible for a lot of the public service jobs that do come up for hire. So that has always been a problem. It's not been a problem of accessing the program. It's once you're in the program, it's actually qualifying for the jobs that become available, given the lack of experience and qualifications for the average applicant.
So the training benefit could help.
Pierre, we're substantially over, and now we find out that votes are moved up to bells at 5:15. So we'll take 2 more questioners in this panel and then go to the next panel. So about 4 minutes each, if you could hold it to that. But Ms. O'Connell.
Thank you, Mr. Chair. Thank you all for being here. I'll start with the mental health discussion in terms of, I'm sorry, I forget who said it now, but in one of the testimony about going into debt for prescription drugs or rationing of drugs, obviously we're talking about the Budget Implementation Act, but then also recently the Minister of Health announced lowering the cost of prescription drugs. Is this part and parcel to that overall vision? Do you think that will be helpful? Or do you envision some other strategy? Because I would assume, and I think we've heard significant testimony, that it's not one size fits all or it's one quick fix, but more work will need to happen. Is that part and parcel of what you see as a step in the right direction?
I think you hit it right on the head when you said one size does not fit all. I mean, mental illness is like a physical illness. How it impacts me and how it impacts you could be two different things, and we might need different medications. One of the challenges that we have seen is the fact that there are new medications that are coming on the market that are much more effective on certain people, and public health care systems right now do not fund those medications. So there's a challenge out there. If you take a look at it from an employer's perspective, if you have an opportunity to assist your employee on getting well quicker and returning back to work, it's a win-win for everybody. So there is, sometimes an additional cost up front, but you always recoup that at the end of the day. So from our perspective, it's very important that if a person comes forward with a mental health issue, they should get the best medication that is suitable for them at the earliest possible time. That being said, there are a lot of Canadians who don't have health care benefits, who don't have drug coverage that covers medications, and that is a challenge. There's a lot of low-income people in Canada that are struggling to purchase their medications. We have medications that cost hundreds of dollars a month. We have medications that cost $2,000 a month. So, it's a big challenge for people.
Mr. Bedard, you mentioned the $20 million for Center of Excellence and your concern in regards to the direction that it's for research versus a physical space. Is that based on something you saw in this actual budget or in the conversations elsewhere, or what's being reported? I understand, and I think the chair also pointed out, that we're in a difficult position in terms of, I think a lot of what yourself and Mr. Campbell both spoke about are those details and what comes next. But in regards to the Center of Excellence, where are your concerns coming from? Is it specifically related to background in this budget, or is it those additional conversations?
Well, I am an advisor on the Mental Health Advisory Group, and I did get to have closer looks at what was being proposed. And it's a bit of a gray area, and it's not very well defined. I need to see it going to physical bodies going into programs. There are existing programs right now that are designed on a low budget, like the Veterans Transition Program, the COPE program, as examples. That's a couples program, and then a one-on-one working in a peer group environment program. VTN has been around for 17 years now, and it's a program that I've put dozens, if not hundreds of people through as kind of a guy going out finding the troops. This money, this was put into the platform, the veteran platform for that election, costed specific for physical bodies to get into a physical program. If the experts at large in Ottawa who've helped get this to look more like something that's going to go towards research, this needs to go to bodies. That was the intent. I don't know how often you have someone come in here and are actually the person who got it put in the promise for the election, but here I am.
Thank you very much.
My apologies to you both. We'll let it cut it there. Mr. Broussard.
Thank you, Mr. Chair, and thank you for the opportunity to address the witnesses. I'm going to get right into it. Obviously, pensions are an issue. The Equitas Society is still fighting the pension problem. Now, the option for pensions in this budget, there's no timeline on the government's commitment to return an option, or they're talking about an option. The Prime Minister never spoke about an option. Would you agree with that?
I would agree that my understanding of the Prime Minister's promise, what we call the sacred obligation, was a return to lifelong pensions. There's only one lifelong pension to return to, and that is the former Pension Act.
And is that clear among the veteran community as well?
No, the veteran community is extremely concerned. I'm extremely concerned that what in fact is going to happen is the trial balloon that's been floated, which is the idea of taking the pain and suffering lump sum, which is a distinct pillar, separate and apart from financial security for life, and trying to turn that lump sum, which was specific to the pain and suffering, into some form of an amortized pension. It makes no sense. It would be hundreds of dollars a month. That's not something you can live on, and it does not provide financial security for life like income replacement and the cost of being crippled do.
Right. So I want to talk about transition services as well, because in this budget it spoke about transition availability for spouses and common law partners. And Mr. Bedard, this is to you. There's been 10 parliamentary studies done, the latest in 2016 by the Veterans Affairs Committee, with strong recommendations on how we can ease the transition of medically released service members into transition life. DND Ombudsman did a report. The Veterans Ombudsman did a report. In fact, the Veterans Affairs Committee report was endorsed and supported by the DND and Veterans Ombudsman. Now there's a new study that's going on by Shaping Futures. Granted, the government is not paying for this, but there is some suspicion that this is going to punt the issue of these recommendations down the road so that the government doesn't have to commit to it at this point, in spite of the platitudes and the niceties and all that stuff. Are you concerned about this new study, that we're not actually going to be able to help our veterans transition properly and that they're just punting it down the road?
I've seen enough study and enough research. I've been to one of these CIMBRA conferences, and they love their research money and they want to divide that apple 1,000,001 ways. We're sick and tired of the research. Give us the apple, right? It's time. The statement from the ombudsman's about that they want to have all your benefits in place before release, I honestly don't know how they're ever going to get there, because here I am 11 years later and just recently finally got approved for a traumatic brain injury 11 years later. And many young veterans aren't as good a fighter as I am. 90% of them have too much pride to even want to fight more than one appeal. Like, enough of this. I'm not going to deal with this. I want to be proud of my medals, and I don't want to have to live out constantly reviewing and fighting things.
I want to speak about the earnings loss benefit and the reaction among the veterans community that they're not getting as much as they thought they were going to get because of the indexing. Could you comment on that?
Well, top up of the lump sum for pain and suffering, in fact. Yeah, $360,000 is the courts, the benchmark for the courts in Canada for pain and suffering. There is general agreement, at least in the policy advisory group, there was almost unanimous agreement that figure is adequate for dealing with pain and suffering, because it's reflective of what your average Canadian receives for pain and suffering, and my pain and suffering is no more important than your pain and suffering. Pain and suffering is pain and suffering. The way the lump sum top-up was actually implemented, by taking the consumer price index and applying it, resulted in less than half of what people were expecting to receive. So there was a serious problem with managing expectations right up front, and we didn't find out about the consumer price indexing application to the lump sum top-up until literally days before it was announced.
It wasn't announced. Our veteran community were finding out from their case managers, and then the day before the budget day and formal announcement of it, I had to corner the veteran ombudsman. I had to redirect 3 questions before I finally got out of him that it's going to be less than half. So.
Okay, that's it. I'm going to allow Ms. Pettipaud-Taylor one question. She never very often asks questions, and it's going to take time for the next round, but Ms. Pettipaud-Taylor.
Mr. Chair, Monsieur Bedard, Mr. Campbell, first of all, thank you for being here today, and thank you for your service to our country. Thank you. Monsieur Rodrigue, Mr. Gallison, as well, thank you for being here, and thank you for your presentations. I follow the work that both your groups do. This topic is very relevant to mine because I'm a social worker and was a frontline social worker for 24 years, worked in the policing area as well, so I'm very familiar with this topic. I'm just wondering if, Monsieur Rodrigue, if you could perhaps elaborate on the return on investments that the $5 billion investments that our government has done. If you could just elaborate a bit on the return on investments with respect to mental health.
Yes. Our argument is to use evidence-informed practices that have been proven to be effective, so to reach the objectives, provide individuals with a better quality of life, as well as being cost-effective or cost-neutral. And in the study that we released about a month ago, we identified 9 of those. So I'll give you a good example. In Quebec, they ran a long-term suicide prevention program that was determined to be more efficient, less costly than doing nothing. That saved 171 lives, so évité 161 décès, 171 décès.
Prevented 171 deaths.
Also contributed to saving almost 4,000 suicide attempts. Children, Better Beginnings, Better Futures in Ontario. It provides over the long term, in terms of cost, a return on the investment and better outcomes for the children and their families. So what we're trying to convey is there are wonderful activities taking place in provinces and territories. It would be critical to validate those approaches and then use them across the country because they are validated, they've demonstrated that they're efficient, they lead to better outcomes for children, their families, and others, and they're also cost neutral or they provide a return on investment.
Thank you, and thank you all for your presentation. We'll have to go to the next panel. I just would say to the veterans, I'm not sure how we can deal with this, whether we send the minister a copy of the testimony you presented and the questions you answered or what, but we'll try and find a way to see if there's anything we can do to push your issue beyond the budget bill itself. So thank you for your presentation. We'll suspend for a minute and ask the next panel to come forward.
Thank you.
Could we reconvene, please? One happy person in any event. My apologies to witnesses for the delay, and my apologies for what is going to be a very tight time frame. We're here, as you know, dealing with Bill C-44. The Act implements certain provisions of the budget. So with us to start off, we have the Canadian Cancer Society, Mr. Cunningham, Senior Policy Analyst. Mr. Cunningham, floor is yours.
Thank you, Chair and members of the committee. My name is Rob Cunningham, lawyer and Senior Policy Analyst with the Canadian Cancer Society. Merci pour l'opportunité de témoigner aujourd'hui au nom de la Société.
Thank you for the opportunity to appear today on behalf of the Canadian Cancer Society.
In Bill C-44 and supporting the tobacco tax increase found in Clause 51. But first, to mention two other items in the budget and to convey our support for the investment in home and palliative care included in the budget. 80% of those receiving palliative care, it's been estimated, are cancer patients. This will make a real difference and improve the lives for cancer patients and their families. Second, we support the introduction of a new and more flexible employment insurance caregiver benefit. Caregivers provide assistance and key services to thousands of cancer patients every year in Canada while bearing significant personal and financial burden. This new benefit will help and has our support. Turning to tobacco, it remains the case that smoking causes 30% of cancer deaths in Canada. We've made progress, but more than 5 million Canadians still smoke. It's a leading preventable cause of disease and death. Higher tobacco taxes are the most effective strategy to reduce smoking, especially among kids who have less disposable income or less likely to be addicted, more responsive to price. And you've had a handout, and this graph shows the comparative provincial and territorial tobacco tax rates. The blue is the rate, the mauve is the GST, PST, the provincial portion of the HST. We see that Ontario, Quebec, it's much lower than other provinces. The green are budget announcements that are not yet implemented. There's a scheduled date to come. On the far right is the federal tobacco tax, which is now lower by quite a bit than most provinces. The yellow is the 53-cent increase per carton in the budget. So it's small, but every bit helps. But just to put a bit of context for this increase. The next page shows the trends in federal and provincial government tobacco tax revenue, not including GST or HST or sales taxes. So there are objectives to increase public revenue in addition to benefiting public health. So we've seen an increase in tobacco tax revenue. That's the idea. The blue line is after inflation, so not as much. But in both cases, I think quite impressive because there's been a decrease in smoking prevalence, and yet tobacco tax revenue is going up. The third page, the next page, is just a newspaper headline where in Australia, a package of cigarettes is going to be costing $40 in 2020. And the final page just compares Australian and Canadian tobacco taxes. Quebec, on the far left, the lowest tax province in Canada. Manitoba, the highest tax province. And then Australia today, far higher. The Canadian Australian dollars are almost at par, $148 per carton. And then with further scheduled increases by 2020. So it's going to go up quite a lot more. We haven't, based on Australia, come close to the ceiling of what is possible. In Canada, we...
To 5 minutes, if I can, Mr. Cunningham, because we are going to be really tight in questions. So you've got 2 minutes left.
There is some contraband that exists. It has gone down compared to 2009. There are some contraband prevention measures that are available that we would support, such as better controls on the raw material filters, the leaf tobacco, to be intercepted prior to getting to the unlicensed factories. There was the end of the tobacco manufacturer surtax. Our recommended preference would have been for that to stay in addition to the higher tobacco taxes. We certainly support the higher tobacco taxes. And of course, this is part of a bigger federal government strategy that we applaud. Health Minister Jane Philpott is moving forward to have a strengthened federal tobacco control strategy. The current one expires in March 2018. Consultations have taken place for that to be enhanced. And as part of that, a strategy that includes taxation, legislation, and programming. And of course, as part of that, as you know, is plain packaging to remove the promotional aspects from the package, as Australia has done, and Britain and Ireland. Just some examples with me of packages actually from Australia. So this is complementary to the tobacco tax increase in this bill. And again, let me close by reiterating our support for the tobacco tax increase. Thank you, Chair and members of the committee.
Thank you very much, Mr. Cunningham. With the Canadian Nurses Association, Ms. Poulin, Director, Policy, Advocacy and Strategy.
Thank you. I've timed my speaking to less than 5 minutes. I'm a registered nurse myself, and I'm here representing the CNA, the professional association for close to 140,000 nurses in Canada. I'm pleased to speak today about the measures related to nurse practitioners in Bill C-44. The measures are under Part 4, Division 11, which focuses on support for families, benefits and leaves in both the Employment Insurance Act and the Canada Labour Code. As for Part 1, we are pleased that the Income Tax Act now includes nurse practitioners, or NPs, under the list of healthcare providers who can certify eligibility for disability tax credits. This measure was effective on Budget Day. As our President noted on Budget Day, these changes are long-awaited breakthroughs for patients and nurse practitioners, and we hope they set the precedent for similar modernization of other related legislation. We're thankful that the Minister of Finance included these measures in Bill C-44. Along with the Canadian Advanced Practice Nurses Association, we encourage members of the committee to accept the amendments that have been proposed to both the Employment Insurance Act and the Labour Code. The amendments formally acknowledge and enable nurse practitioners to fulfill their important role as primary care providers, in particular for Canadians who live in rural and remote locations in Canada. Members of the committee are also aware that the Senate Committee on Social Affairs, Science and Technology will be discussing a pre-study on Division 11 of the bill, and we encourage them to support these amendments as well. To have a sustainable healthcare system where services are accessible to all Canadians, health professionals must be permitted to practice to their full scope of regulated qualifications. For nurse practitioners, these qualifications include the ability to perform comprehensive patient assessments and complete related documentation. I'll give you a brief overview of the nurse practitioner role to illustrate the benefits of these amendments. Nurse practitioners are registered nurses with additional graduate level education and extensive specialized healthcare experience. A protected title and regulated across Canada since the early 90s. Today, almost 5,000 nurse practitioners provide care to over 3 million Canadians. Within their scope of practice, they conduct physical assessments, they order and interpret tests, they can admit and discharge to hospital, they can prescribe medication. As you know, they can provide medical assistance in dying. They complete advanced practice examinations, and they must be registered with their nursing regulatory body in order to practice. While nurse practitioners work in diverse settings, urban and rural, they are commonly the first point of contact for primary care, particularly in rural and remote communities. Like many primary care practitioners, it's not unusual for nurse practitioners to have a patient panel of over 10,000 patients, so it's a very broad in scope. And to illustrate the scale of care provided by nurse practitioners, if you just look within First Nations Inuit Health Branch, nurses, the nurse-to-physician ratio in rural and remote communities is primary care is provided at a ratio of over 26:1 nurses to physicians. They truly are the gateway to care. From this, it's clear how outdated legislation drafted before nurse practitioners were recognized as a protected title and became key primary care providers. These barriers are real, and they prevent access for many Canadians, and in particular for Indigenous peoples, where the most local care is likely through a nurse practitioner. By including nurse practitioners among those who can complete documentation, such as the medical certificate for employment insurance compassionate care benefits, patients will have increased access to benefits to which they are entitled. Unnecessary personal costs to individuals will be avoided. Duplication in services between nurses and physicians will be reduced. In the end, red tape will be cut, and Canadians will have better access to care and also better value for their tax dollars. Finally, our expectation is that these cost-effective changes will trigger a similar modernization of legislation at the provincial and territorial levels. Similar modernization must still be made to include NPs as qualified medical practitioners under the Employment Insurance Act, specifically to include NPs in Section 54 and 4 sections of the Employment Insurance Regulations. Further, 5 sections of the Canada Labour Code and subsection 207.2 of Bill C-44 must similarly be amended. In closing, I encourage members of this committee to support the bill, as its measures will improve access to care for over 3 million Canadians. We are of the belief that the additional sections that do not add NPs must be implemented in this important bill as well. Thank you to the committee, and I look forward to your questions.
Thank you, Ms. Poulin. With the Canadian Care Advocacy Association of Canada, Ms. Ballantyne, Executive Director.
Thank you very much, Mr. Chair and members of the committee, for the invitation to be here with you this afternoon. I'm going to try to get through before the bell rings. There's no longer any dispute that parents in Canada with young children are in desperate need of greater government support. High-quality childcare is limited and financially out of the reach of the great majority of families. Consequently, parents, and particularly mothers, are forced to find alternatives. They withdraw from the paid workforce, or lessen their attachment to it, or delay entry. Or they turn to more affordable, lower-quality, makeshift childcare arrangements. The damage to children's well-being, to women's economic equality, to family security, and to the Canadian economy is severe and well documented. The Liberal Party of Canada's election platform promised economic security for the middle class and help for modern Canadian families. As part of this commitment, Canadians were told a Liberal government would ensure, and I quote, the availability of affordable, high-quality, fully inclusive childcare for all families who need it. Yet neither the Liberal government's first or second budgets delivers on that promise. The 2016 budget gave only 1 year of funding for early learning and childcare in 2017. The 2017 budget allocates funding in each subsequent year until 2028. Yet the sum of money to be transferred to the provinces and territory each year falls far, far short of what is required to build a fully comprehensive childcare system for over the next 10 years. The funding starts in 2017 at only $500 million. By 2022, it will have increased by only $50 million, and that amount has to be divided up between 10 provinces and 3 territories. To put this in perspective, the province of Quebec alone already spends $2.5 billion a year on its childcare program. Further, following the tabling of the budget, both the Prime Minister and the Minister of Families, Children and Social Development publicly stated that the government's intention is not to help all families access affordable childcare, but rather to target the support to those with low and modest incomes. In other words, they're abandoning the middle class when it comes to childcare. And they're acting in direct opposition to the contemporary international consensus and the overwhelming research that affirms a universal approach is more effective than a targeted one. Only a universal and comprehensive approach can generate the well-documented economic benefits of early childhood education and care, help all Canadian families and give them the choices of childcare that they seek, and sustain ongoing public support. More importantly, the research tells us that universal early childhood education and care is the best way to meet the developmental goals we wish for all children, regardless of their family's social or economic status. The direction the government is taking on childcare is not just insufficient, it runs contrary to evidence, and it actually sets us back. This is also true of the related changes to the maternity and parental EI benefits set out in Bill C-44. During the public consultation process on these changes, the most common reason given by those who supported the government's proposal to extend the leave period to 18 months was the lack of available affordable childcare for children under 18 months. But reducing parents' EI parental benefits so that they can stay on leave longer is a bad substitute for affordable quality childcare for all. What would really help working parents before and after the birth or adoption of children, in addition to affordable childcare, is easier access to maternity and parental benefits and higher benefits. As it is, too many parents don't qualify or can't afford to forfeit their regular paychecks. Changing the EI program in line with the already tested Quebec Parental Insurance Program, the QPIP, would be a much more positive step forward. I've provided the clerk of your committee with an organization's very short brief on the proposed changes and why we think they are wrong. I hope you will give it consideration as you debate Part 4, Division 11 of Bill C-44. Thanks for your consideration.
Thank you very much, Ms. Ballantyne, and for your direct approach. I was hoping the bells, might be delayed, but no such luck. Ms. Ballard. As an individual. Go ahead.
My purpose today is to speak to the changes occurring from the budget tabled in Parliament on March 22nd, 2017, specifically changes to the maternity and parental leave benefits from the Employment Insurance Act and Canada Labour Code. For those of you who are not familiar with my story, it was the inspiration behind MP Mark Gerritson's Private Member's Bill, Bill C-243, an act respecting the development of a National Maternity Assistance Program strategy and amending the Employment Insurance Act. In 2014, I became unexpectedly pregnant. At the time, I was working a dangerous job. I was not able to continue in my position with my employer while pregnant due to the many hazards of the job, and my employer was not able to offer me accommodation by way of a suitable temporary position. I discovered then that there was no coverage, federal or otherwise, for an early pregnancy leave from a dangerous job. I became very entangled in our system, dependent on programs that weren't designed to sustain me in my situation. I campaigned the issue to the 41st Parliament without result, and not one to give up easily. Once the 42nd Parliament had settled in, I took the issue up again with my new local MP, and from there, in an effort to amend the issue, Bill C-243 was created. My early leave, maternity leave, and parental leave was a tumultuous time in my life, wherein I gained a lot of insight of what it's like to be a vulnerable person failed by our social system. I am now in what I call the hamster wheel of poverty, having to constantly concern myself with housing, moving, affording basic needs, and parenting, with little energy and resources left to actually improve my situation. This is the result of a social system that has not kept up with both the cost of living and the diverse needs of the population. This is what happens when cost of living is not delivered. And it's worth considering that I am more expensive to society in the hamster wheel than if I had just had a proper leave program to begin with. I hadn't expected to fall into a federal aid gap. I didn't know there was one. To say I'm disappointed with my maternity leave experience is an understatement. I am devastated, but I'm also solution-driven, and playing a part in improving the system is putting purpose to my pain and allowing me to move on. While the upcoming changes to maternity leave from the budget tabled on March 22nd, 2017 are what can be best described as a small step forward in the right direction, they are most welcomed all the same. I've noted a common theme from families and professionals offering feedback on the maternity and parental leave program in Canada, and that is simply the ability to customize. Customize a leave that works best for their growing family. Our circumstances, abilities, priorities, and aspirations are so varied in this country. As Canadians, we need options that acknowledge those diverse needs. I am pleased to see this budget allows for the addition of an extended leave option and more flexibility to timing the start of maternity leave. I must, however, criticize the payment of parental benefits over a long period at a lower benefit rate of 33%. The lower rate disincentivizes use and is less likely to be found as a viable option to low-income or single-parent families. But it is an option that adds flexibility for some families, and with the attitude that it can be improved upon in the future, I support it. While I understand that protecting the 15-week maternity leave period from the pressures of work for the purpose of safeguarding health and allowing child-parent bonding is extremely important, I encourage you all to look at parental leave a little bit differently, because 33% of most people's income is not going to meet their cost of living. Either the federal government needs to meet the cost of living, or the regulations restricting income earning on parental leave need to change. People from low-income households, especially, are being alienated from these services. Adding flexibility for low-income people without added cost to the government is key in broadening Canadians' abilities to customize their parental leaves. I am not aware of an EI program that allows for a combination of receiving benefits while partially working. But if the federal government cannot afford to offer the cost of living during parental leave, then it's not useful to low-income families. For these families, or even parents in competitive careers who are torn between quality time with their children and not falling behind at work or on bills, consider it. Consider, for example, in a typical 40-hour work week, 22%, the difference in this case, of pay comes from just 9 hours of work. Consider allowing a recipient of parental leave who does not otherwise receive a top-up from work, or for whose income is below a threshold, to select the 18-month leave and top themselves up by working up to 18 hours in a biweekly period, or 22% if they wish. This is a flexibility that would benefit low-income families. The result would be 6 days a week with their child instead of foregoing the program and only getting an average of 2. While working to strengthen the middle class, let's make sure we're dropping ladders down the poverty pit so the middle class is not strengthened on the backs of people in poverty. I applaud Minister Morneau's tabled budget changes for maternity and parental leaves and the government's efforts in improving the system. Thank you.
Thank you very much. It's not hard to see when your age group, you're using the computers, most of the rest of us are using this stuff. Thank you all for your presentations. We will at least get each party on and probably one more. So starting with Mr. Sabara, 5 minutes.
Thank you, Mr. Chair, and welcome everyone. Great to have one here today. You know, the comments this afternoon, give me a lot of perspective, or I have some perspective. I have 2 kids that are 4 and 6. We live downtown in Toronto before we moved up to where I live now, and we had to go through the daycare system there. We know what the waiting lists are all about. We know the expense of up to $2,000, sometimes a little more than that, a month of daycare costs, and even in the suburbs, it's very expensive. You know, our government has put into place a number of different measures to help families, because every family has different needs, and some are unique, some are not, some are more standard in terms of work weeks and so forth. So in my view, there's never been one size fits all. We introduced the Canada Child Benefit, an extra $5 billion a year to Canadian families every year. Now we've put a substantial amount of funds, over $500 million a year for childcare, which will come to agreements with the provinces, aimed at helping those that need it the most. And I agree with that perspective and that view. So I thank you, Ms. Ballantyne, for your comments. I do wish to ask Ms. Poulin, because I think in our budget there were 2 things that were very substantial. A, the consolidation of the caregiver tax credit, and secondly, the nurse practitioner expansion. And I just want to hear how profound, and I'm going to use the word profound, was that change in terms for rural Canadians, I mean, put on the rural lens, for Canadians having and allowing nurse practitioners to be more involved.
I can't overstate what excellent news this is. We really view it as, provided the budget is passed, that it is a win-win-win situation. My statistics are accurate that over 3 million Canadians are provided care primarily by nurse practitioners, from my in-laws who live in Peterborough to over 600 Indigenous communities across Canada. This will not mean more benefits. What it will mean is faster access to benefits that patients have long been entitled to, and this will mean significant improvements in quality of care and quality of life for many, many Canadians. In addition, nurse practitioners and physicians alike will greatly appreciate this enhancement to the efficiency under which they can deliver care.
Thank you, Ms. Lynn. Mr. Chair, I'm going to stop there. Thank you.
Okay, thank you. Mr. Deltel.
Mr. Helmus.
Oh, Mr. Alvis, okay.
Thank you, Mr. Chair. I want to thank all the witnesses for being here today, and unfortunately we don't have enough time to be able to give each one of you as many questions as we might have. I'm going to focus my comments to Mr. Cunningham. Mr. Cunningham, I'm aware, and I do appreciate you bringing some of these examples here. I've asked, I have an email here from an emeritus professor of medicine from the University of British Columbia here on the Center for Heart and Lung Innovation. He has basically said that there is the same amount of risk, comparable risk for cancer and COPD, and COPD is chronic obstructive pulmonary disease, when you smoke a marijuana cigarette or a regular cigarette. Would you agree with that?
Well, I think the carcinogenic contents of the smoke are similar. The difference tends to be how much people tend to consume, like the dose response. Most people smoke a small number of cigarettes per year or per month compared to tobacco cigarettes. If somebody was smoking a comparable amount of marijuana cigarettes, the risk would be similar, but there aren't that many people who do that. In terms of secondhand smoke, again, the contents are similar, and that's why governments are moving to ban marijuana smoking wherever smoking is banned.
I would also suggest, though, sir, that there is a difference between a regulated cigarette when it has filters and certain standards for contents and whatnot, and a marijuana rolled cigarette. Is that correct?
So there's no actual regulations for tobacco cigarettes, and marijuana cigarettes vary. They're not all the same. And it may very well be that for a marijuana cigarette, it's smoked more intensely than a tobacco cigarette.
Yeah, but there's no filter or whatnot as well, so that I'm sure it would have some to do with that. I have spoken with some doctors in regards to this, and like I said before, there is a comparable risk, is what it is saying. But and your presentation here is quite helpful because Minister Monroe is going to be going to speak with his provincial counterparts on the subject of how much marijuana should be taxed. Now, are you calling for a similar regime as to cigarettes?
So I think a similar regime for cigarettes.
You're suggesting on behalf of the cancer.
I think that there's going to be a level of marijuana tax. One of the things that's in the bill that's important is you get to design a system from the get-go to prevent contraband. So there's a measure to have from seed to sale, and in terms of better markings and better tracking and tracing systems that don't even currently exist for tobacco. So that is an opportunity to get things right. I think that the intent initially is to have a low tax rate, and then over time to increase it. First to take a big blow to the illicit market, and then eventually there'll be further increases.
Because, the contraband tobacco, and I'm really happy that you raised that, is actually becoming quite a problem where we've seen in British Columbia products that are made in Ontario and Quebec now spreading right across. I've even heard anecdotally that they've seen some in international markets. So contraband tobacco is a big issue. And part of the reason some people have said is what they've alleged is that when you go with higher excise tax and other forms of taxation, that makes it infinitely easier to get someone to switch over from a legal product to an illegal product. So are you worried at all that by increasing excise taxes, as you suggested, that you may actually aggravate that?
British Columbia has done very well compared to other provinces in terms of having lower levels of contraband. In fact, there's no illicit sales on First Nations reserves in BC or in the Western provinces in terms of the smoke shacks that are widely prevalent in Ontario and Quebec. Our view is that the tobacco industry exaggerates the level of contraband. Their studies are flawed, and that they fund and that they do.
Cases do not, change behavior.
They certainly reduce smoking. And Ontario and Quebec have the lowest.
I'm trying to understand what you're getting at.
Higher tobacco taxes certainly reduce smoking, especially among kids who are more price sensitive. The issue we have in contraband today in Canada is because of illicit factories, illegal factories located on a handful of reserves in Ontario and Quebec. That's the source for the bulk of the contraband we have. Western Canada is far away, so and there's much better control systems, so the contraband levels are much less prevalent. But Ontario and Quebec have the lowest tax rates, but the worst contraband. So that's an indication that it's not related to tax levels, but rather proximity to supply and the illicit factories. So there is potential for action. This increase is relatively small in the big context, but at the same time, contraband prevention measures that are complementary could be implemented.
Mr. Dussault.
Merci.
Thank you. Thank you to all of you for being here today. I'll be very quick. I'll try to ask a question to all of you. Mr. Cunningham, to start out, how much money is spent by the federal government on preventing tobacco use? Should more be done? Should the taxes raised by tobacco be used for prevention, and should it be sent to the provinces? The federal government collects $3.25 billion in tax revenues from tobacco and spends $38 million. In the past, it was higher, $72 million. Per capita now, it's only $1.04 per person in Canada. In the United States, it's $3.71. Minister Philpott is looking at this, looking at what's possible. We support her efforts, and we'll have a new strategy federally, and I'm very optimistic. Certainly, we should be having more for prevention and an advertising campaign to reduce tobacco use. Now, Ms. Ballantyne, regarding early childhood, having a leave from 12 months to 18 months, but with 33% rather than 55%, do you consider that something positive, or do you see it? And I've said this in other places. You know, you're getting 30 cents on the dollar, or rather, it's 6 of one, half a dozen of the other. There's no real progress in the system with this.
Changes to be negative because what it will create is a situation where some parents have access to a longer leave and most will not. So we cannot see how a reduction in the benefit level under EI could be seen as a positive development. We also think that although the government seems to know what the problem is, and that's that there is lack of affordable childcare for children under 18 months, they've come up with the wrong solution. The solution is not to have parents on leave for the 18 months at lower pay. The solution is to actually create affordable childcare for all, and not just lower and modest income families, but all families of all income levels, because we know from evidence that's actually a better way to create choice for everybody, and it's actually a better way to create opportunities for lower and modest income households. We have a saying that if you have a childcare program that is for the poor, it will make for a poor program. And what we want is a universal childcare program because it will actually benefit everybody. We think in terms of EI changes, the priority of the government should be to make access easier. Right now, 40% of parents are excluded from the Employment Insurance Maternity and Parental Special Leave Program. You compare that to Quebec, which is a much better program, only 11% of parents are excluded. And in Quebec, I want to say that the benefit level is at 70% of replacement income. And in Quebec, there's also flexibility, but the flexibility is actually to take less for more at 75% replacement income. That's a much better option.
Non, tout à fait. Je pense que ça met en lumière aussi un des problèmes.
Right, I think this also highlights an issue that was raised. A public servant had to agree that one of the problems is that the employment insurance system, well, only 4 out of 10 employees have access to it. And they confirmed that to access the parental leave, you have to be qualified for EI. So clearly there's a problem there for workers. That being said, given that we're studying Bill C-44, do you think it would be a solution to eliminate that aspect and to instead increase the percentage to have a higher rate, higher than 55%? Is 55% enough?
Our position, and it's set out in the brief, is that the changes that should be made is to bring the employment insurance program in line with Quebec. It makes no sense that citizens and workers in one province would have superior benefits to the rest of the country. That is our position, and we would propose that your committee should recommend that in studying Bill C-44, because that is not, in fact, what is being advanced in C-44.
We'll have to cut it there. We will have time for two more questioners at about 4 minutes each. And I understand Mr. Ells is here from Veterans Committee. If you want to explain what happened there, come to the table in a minute. We'll go to Mr. Fergus. Yeah, okay. If you can hold it to it, 3 or 4.
Super. Alors, tout d'abord, merci d'être venu.
First, thank you. I'm an MP from Quebec. I know Mr. Cunningham is the only one who speaks French, so I will make my questions in English mainly.
In regards to Universal Child Care Program, this is a program that's near and dear to my heart, having been a stay-at-home dad with my kids when my wife and I job shared when we had our children, and stay-at-home dad as long as possible, and I always used to complain about the lack of parental benefits that I was able to take care of. The question which I have for you is in regard to the Universal Child Care Program. I mean, with your experience, you know that Quebec had started off along that line to have a very generous Universal Child Care Program, and which was very, very popular. But over time, due to fiscal constraints, had to make some very difficult choices, and as a result, they moved to one which, if you made more, you pay more, and if you made less, you pay less. It seems that the federal government is approaching this from a different perspective, but with largely the same results. Do you have any comments on that?
Yes, just first of all, on your comment about being a stay-at-home father, one of the big advantages of the Quebec Employment Insurance Program is that it actually gives paid leave under the EI program exclusively for fathers. And that's another improvement that we would want to see in the EI program.
I just have to say I was a stay-at-home dad 20 years ago. So it was before the programs came in. Yeah. I wasn't able to take advantage of it.
On a question about Quebec's child care program, I would suggest that it actually was not, the changes made to the Quebec program were not as much a result of fiscal constraints as opposed to fiscal choices. What the Quebec government chose to do is reduce the amount of public funding for the universal child care centers, the Centre des Petites Enfants, and family home-based child care, and instead put more public money towards providing tax credits for families who access the for-profit private sector. And so there's still a lot of money being paid out, but it's not going towards boosting universal access. It's actually going towards supporting for-profit childcare, the for-profit childcare industry. That was the mistake, in our opinion. But those families who are fortunate to be able to access childcare under the Centre des Petites Enfants, it is still much more affordable in Quebec than it is the rest of Canada. So that is what we're looking for, is a childcare program that is affordable. We're not saying that it should be free necessarily, but we're saying it should be affordable. And we think that the best way to finance a system is actually to provide, as Quebec has done in the case of the Centre des Petites Enfants, to provide direct public funding to the providers of the child care services, and then whatever fees would be collected from parents would go to the government to help subsidize the cost, as opposed to the other way around, as opposed to giving money in the form of subsidized to parents, because what that does, it doesn't create childcare spaces. What it does is it gives parents some money to go on a childcare market to try to purchase services which unfortunately are not as high quality because they're not directly funded through public funds.
Mr. Deltel, about 3 minutes.
Thank you so much.
Mr.
Cunningham, I would like to address what you said a few minutes ago. Very interesting, by the way, and I do appreciate your testimony. When you talk about Quebec and Ontario, where you have the most illegal situation, maybe it's because this is where you have most people, and also this is where the illegal manufacturers are. Maybe it can explain that maybe more than the taxation. Speaking of taxation, my quick question is, Where do you think, this is the good old laws of too much taxation, kill taxation. Because if you tax too much, people will find other ways, which are illegal ways. Where do you find the breaking point of too much taxation for tobacco?
Yeah, I don't think we're anywhere close to it, but I think you're right about the location of the illegal factories and close to major urban centers in Ontario and Quebec. And I think those have to be targeted. BC, the Western provinces, have been able to sustain far higher tobacco taxes without the level of contraband seen in Ontario and Quebec. In Australia, they're far higher yet. So I think we have to fight contraband, but there's lots more potential that remains.
Sir?
Thank you, Mr. Els. I understand you're just getting back from D.C. Hope you would found some sense down there, maybe. Floor is yours, so you can explain what happened.
And thank you, and I appreciate just a minute of your time here today. Appreciate you sending your motion to ask us to study that. We wish we could do it. If the deadline was extended, we could. Under the circumstances with today, I was with Mr. Kitchen, the Vice Chair of the committee last night at 6 o'clock in Washington. We sat with the clerk and looked at the situation. We tried to see if we could get a room in the Parliament today. Unfortunately, the room we wanted, we're in it now and it is booked. We agreed maybe tonight at 7:30 after votes. Unfortunately, with the witnesses from New Brunswick, a little bit of a time difference. And so we decided on 9:30 tomorrow morning. That was agreeable. After a little bit of Mr. Kitchen talking to his counterparts, he came to me and he decided that we could get through this without having the meeting. So we agreed as a team not to go forward with this and offer to the committee, if they could extend the deadline, that we could look at it.
We'll leave it at that. We understand. We ourselves are fairly used to extremely tight deadlines, and I think there's a message to add of that to the system. We need to find ways of giving all committees, including our own. We're hearing from 55 witnesses this week and partly last, and we honestly don't have enough time to question the 4 witnesses that have taken their time here adequately either. And so with that, we are 2 minutes away from voting. I will thank each and every one of you. Your presentations are valuable to us, and your testimony will be looked at. So with that, I appreciate you coming, and meeting adjourned. Members, tomorrow we are in Wellington Building at 11 to 1 and here from 3:30 till 6:30. Meeting adjourned.